Good morning. Nick Markey here, fitness physical therapist and trainer here, Beach Barbell Physical Therapy and Gym in Wilmington, North Carolina. Just giving you a little bit of a survey of our landscape here. Mostly free weights, dumbbells, kettlebells, racks, barbells, a few specialty barbells as well. More or less mostly what you would need for general strength training. Not as many machines, not because there's anything wrong with machines, just they can take up some space and usually they only really work one area. So using dumbbells and barbells, you can use them for a lot of different things, basically the whole body. So Perry's across the street, they're doing Port City Young Professionals tonight. So have no excuse not to go because it's literally right across the street. So I'll pop in there and say hi and point people back to the gym and clinic. The main thing I wanted to talk about today was why we do what we do. When I first got into wanting to do physical therapy, I was playing JC football, junior college football, and nothing spectacular or anything, just didn't know what to do with some of my time after high school. And so I hurt my elbow sophomore year and worked with the athletic trainers, and that was pretty cool. So kind of looking around as we were doing our rehab, I figured, well, this is what physical therapy is, but physical therapy, you work with everybody, not just athletes. And so kind of led me down that journey. My first outpatient experience, so you have to do observation hours before you go to physical therapy school, was meh. Mostly just applied what are called modalities. So electrical stimulation units, ultrasounds, hot packs, ice packs, some massage, more or less what you could call just passive care. I didn't really get to see any much of physical therapy as I would have thought it to be in action. So it was a little discouraging, to be honest, and I actually thought even though I was leaning towards wanting to be in an outpatient setting, like a clinic setting, that discouraged me from it. But then I ended up doing a observation and some work at the local hospital there in San Diego. And that was a lot more interesting because, we were helping people, get up and out of bed, helping them walk. They were going through, all sorts of medical stuff, whether it was like a surgery, total knee or total hip, or just some general medical issue or general surgical thing, but helping them get moving again. And that was actually way more interesting. So I thought I wanted to be a hospital physical therapist. Then went to school, and school was cool. Had a pretty nice gym at Sacramento State, and got to do a lot of working out as we were learning, anatomy and kinesiology and more biomechanics and whatnot. And so that was really interesting. And then my internship up at Travis Air Force Base over in Fairfield, California, was pretty good. Got to work with primarily active duty, but occasionally some dependents and veterans. And it was really cool because we were able to do a lot of programming, exercise programming. There was a bit of passive care as well, but that was not as much of a focus as much as getting them active and getting them going. And so that was really interesting and actually gave me a lot of encouragement to get back into outpatient physical therapy. But one thing I did notice was, there were, majority of the patients would get better. You do your stuff and they would be fine and they'd get back to life. And then, but some of them, I estimate maybe 20-ish%, just would never their symptoms wouldn't cease. And so it was just really weird. It was like, well, I was taught that, if you work on all these things, get these things better, strength and range of motion and all this stuff, then everything will be fine. But, there was a handful of people that were not, they're still feeling symptoms. So it just didn't make any sense. So that's when I did what most people do. I went on the internet and eventually found some really good resources of stuff that really I wasn't really exposed to much in school, about pain and how it works with the nervous system and the spinal cord and the brain, and just kind of a deeper understanding of what's going on, and really changed my whole perspective of what therapy, physical therapy is, and kind of pushes it more to, thinking of it like therapy, just for our specific purposes. We work on more function and, quote unquote physical, but in reality there's really no demarcation line between physical or mental or emotional. They're all kind of working together. So led me down a path of further understanding of that and trying to understand how to help people navigate these things better, just because a lot of people were experiencing these long-term pains and promised all sorts of stuff, whether it was surgery or this treatment or that treatment, and still not doing well, still suffering. And so what I started to look at more was, how do I, one, help people get more active and confident with themselves, even regardless of pain, because unfortunately sometimes people that have chronic or persistent pain, we necessarily can't stop that from happening, but maybe if we can switch the focus more towards thinking about what they can do, or what things are tolerable. Are they able to go for a short walk or something and not have as much pain, or can they actually do some weightlifting? There's been some decent research on even heavier weightlifting with people with chronic pain, and them doing reasonably well with that. Ultimately, it's a variable experience, and I try to keep it simple and ask people, what are the things you like to do or want to do, and is there a way we can do those to any degree, even just a small amount, and with not making the symptoms worse. Even if you maybe still have some pain while you do that activity, but as long as it's not getting worse, then I think the trade-off for them is a good one. And then oftentimes they'll start to enjoy life maybe a little bit more because they're able to do those things that they actually like to do. So that's kind of where I'm at, and obviously you can see I enjoy weights. I think the simplicity of the weights is a nice factor. You have some variables you can adjust, and it's relatively easy to progress, move forward, and it's relatively easy to regress when things maybe flare up or maybe you're not feeling as strong or good. So I think it's a good way to promote activity, because obviously when someone walks in here, you're not seeing your standard, maybe physical therapy clinic. You're seeing a bunch of, equipment, weightlifting equipment that would make you think, okay, well, we're gonna get active here. It's always important to get that buy-in. Obviously, I don't force any sort of weightlifting on anybody. It's a good thing for everyone to do, just for their overall health, regardless of if they're dealing with pain or not. But oftentimes, if someone can maybe, start doing some lifting, even while they're dealing with pain, and as long as you manage it appropriately, and maybe that just means you don't do certain exercises, or maybe you don't worry about doing the area that's painful and you just work on other areas. Sometimes there will be a temporary effect of decreased pain, and sometimes maybe even longer. as well as person gaining confidence that they can actually do things and not be sidelined or just that they're not capable, you know, when you can show them that they are capable, and it's okay to start with, you know, just a little bit and work your way up. But that's kind of my main shtick, so that's why I kind of use the moniker fitness physical therapist, because I think the health aspect to it, just even regardless of pain, is an important thing, and I want to be able to promote that as a medical provider, you know, because it's only something like 20% of people report that they're even doing the recommended guidelines of 2 days of lifting per week, which if more people were doing that, you know, it's very likely we would have a lot less issues with things like sarcopenia. That's where, you know, loss of muscle mass as we age, and that's a relatively good predictor of increased mortality in the older decades. So literally lifting weights and increasing your muscle mass can make you harder to kill, for lack of a better phrase. What else? And just overall getting people more active, and because there are a lot of diseases of inactivity that unfortunately plague our society. It's kind of a modern double-edged sword. You know, we have so many awesome technologies like this phone that I'm recording a video on, but perhaps some of this convenience also leads us to not being as active. And so if we can promote that in some fashion, and maybe if somebody that normally doesn't feel comfortable going and exercising, but, you know, when they hear that this physical therapist is, you know, having people doing weightlifting and stuff, and it's perfectly healthy and you can do it in a gradual manner, it doesn't have to be, you know, progressed in some crazy way or anything like that. You can take your time with it and get used to it, and that's probably the smartest way to do it anyways. Then perhaps that'll help convince or give people encouragement to do it as well. And there's a lot of other good fitness gyms around that do all sorts of, you know, different styles, like, you know, Orange Theory and CrossFits and, you know, yogas and, you know, boxing gyms and whatnot. And all of those are good too. So, you know, it's kind of finding your place that you feel comfortable and confident working out and exercising in. So I'll go ahead and sign off here, coming up on, you know, over 13 minutes. So again, I'm Nick Markey, fitness physical therapist and trainer here at Beach Barbell, Wilmington, North Carolina. Thank you.